Okay. So we are going to try to make sure that we keep the session short, but making sure we make the most from this session. And I will start by just asking each of our panelists to just briefly once again introduce themselves, and then we will start our session. We'll start from my end going.
Good morning, everyone. I am Glory Angeo Oyet. I work with FinTouch 8 as the ECD coordinator. Thank you.
Thank you, Timothy. Good morning, ladies and gentlemen. Good morning. My name is Franco Tolea. I like Tolea most because it is original. I'm Assistant Commissioner for Children Affairs in the Ministry of Gender, Labor and Social Development, standing in for Commissioner. A little bit about me. I'm a village boy who benefited from home learning, where my mother was the adult literacy instructor, and she taught me before I could go to P1 to acquire the basic literacy skills. I was moved from P1 to P2 straight. I think that prepared me to sit at the table of men and women in the best schools, including the best university Mondo talked about. That time, it was not easy for a rural boy like me to come to the university. That time, where only 40 people were admitted to do social work and social administration. I have more about it, but that's for another day. Thank you.
Assalamu alaikum wa rahmatullahi wa barakatuh. Peace be upon you. My name is Lahaji Mahmoud Kateriga, Omtaka Namuguzise Uganda. From Uganda Muslim Council, standing in for my colleague Peter Pewa from Church of Uganda. I'm not from Church of Uganda, but since there's Intelligence Council, I can represent him. Mahmoud Kateriga is the chairman of Education Committee, Uganda Muslim Council, and I'm the National Programs Coordinator at Uganda Muslim Council. I like this forum because my childhood, I benefited a lot from play as you learn. Those who ever heard of Katerega Nampira in the Uganda Cranes, I'm the one. So I earned a lot. Even I played professional in Bahrain and a woman. This is how I used to look like when I was a footballer, but when I put on this, you cannot recognize me. So this is Katerega. I'm so much passionate about early childhood. So I'm the Katerega from Uganda Muslim Council.
Thank you.
Good morning to you all. I'm called Victoria Kello, standing in for Trevor Biranshesha from Save the Children. I'm the project manager for Nurturing Care Framework in Save the Children, based in Yumbe. I hold a bachelor's degree in human nutrition and dietetics from Chambo University and a master's degree in public health from the Hebrew University of Jerusalem, Israel. Thank you.
Good morning. My name is Wai Dragamulai. I'm the District Education Officer Koboko. I am an advocate for home learning centers, especially in the village areas, and then the ECD centers in the town. Thank you.
Thank you very much. I think we do have an idea of all our panelists. I'd like to welcome you. I also want to request that when you speak close to the microphone so that even the people at the back can hear you. Our session is focusing on the NECD policy. We are looking at the implementation, especially within the ECC centers. We're going to try to examine what opportunities exist, but also what are some of the challenges that we are facing. And so I'm going to ask each of the panelists to provide a brief overview of your work in line with delivery of integrated ECD services within the ECC centers. So I'm going to start with Commissioner Tolea from the Ministry of Gender, who are the lead coordinators of the policy framework. Share with us a brief from the ministry on the work that you are doing to implement this policy within the ECC centers. Thank you.
Thank you so much, Moderator Timothy. Since we are talking about children, allow me, since most of our partners are here, to inform them and prepare them that June 16th of every year, we commemorate it as the Day of the African Child. You have been a partner on this. We'll be inviting you very soon for the preparation meetings. I know many of you are waiting for when the meeting is starting. Very soon you'll receive it. That said, we are all aware that Ministry of Gender, Labor and Social Development holds the national machinery for the development or for creating of an enabling environment for the well-being of a child in terms of initiation, development of laws, policies, guidelines, standards, capacity enhancement, and resource mobilization, as well as M&E frameworks. That said, in line with that mandate, this particular policy provides the overall framework guidance. One, for coordinated, integrated, and all-inclusive IECD service delivery. This particular policy, Timothy and colleagues here, guides all other frameworks that we develop by the line ministries and so on. In line with this particular policy, the integrated, actually it's national integrated IECD policy, we made it simple further by developing the national service delivery standards with our partners, especially Ministry of Education and Health, to make it simpler for adoption and implementation by partners. We, as a ministry, responsible as guided by this policy, is responsible for coordination arrangements and establishing the necessary coordination structures. At the ministry level, we have a technical working group. This technical working group meets very oftenly. Many of you have participated in that. We have invited you to participate.
Commissioner.
Yes, please.
I'm going to cut you short because you're going to answers to the next question I will ask. So
okay, I'm the young antelope dancing before the real dance starts.
Yes,
okay.
Yes. So,
okay.
But thank you. I think we have got an idea.
Yes.
We're getting a brief from each of the panelists. Let's hear from Finchurch 8.
Thank you so much, Mr. Opoba. To ensure that our centers, it is integrating the services which is intended for the children, we have used our centers as a point of creating awareness on good parenting, and this has been done by us adopting the parenting session using the KFCP, the Key Family Care and Practices. And this has been used in such a way that we have been targeting parents who are having children going into an ECD centers, and it is annexed to the ECD center. We are using the caregivers and then the village health teams in the community. We've also tried, we have also made our centers a service point by encouraging malnutrition screening to take place in our centers, deworming, and then some other children things also to take place. And we have also encouraged child health days by creating awareness and then encouraging the parents to send their children to also attend the child health days. Not only that, we have also looked at how we can support the committees at the district level and then the sub-county level, all the quarterly meetings, so that they can discuss how we can awesomely support children, not only in our centers, but then also children who are in the community. And we've also looked at how best we can encourage breastfeeding mothers to ensure that they are breastfeeding children until the age of 2 years and then weaning them off and ensuring that children are kept healthy. Thank you.
Okay, thank you. Haji?
Okay, thank you. Colleagues, as you are aware, we are the major stakeholders in ICD as FBOs. Most of the service points are owned by FBOs. All the hospitals in the country, 98% are owned by either Church of Uganda, Uganda Muslim Council, or another faith-based organization. We go to schools. All the schools, most of them, we are the stakeholders. Then we come to the community-based organizations. Most of them emanate from us. Then lastly, the primary and the pre-primary ECD centers, 98%, they're owned by either one of the faith organizations. For integration, whatever policies which the government makes, FBOs just support. There's no better policy than the Quran and the Bible. But it's very difficult to confuse the community if you don't integrate them within our pastoral work. What do? We mobilize the communities. We convince the communities to take on whatever policies the commissioner has said. For example, Uganda Muslim Council has got about 78 Muslim districts, which is equivalent to 138 districts. We have got department heads which sit or participate in the quarterly meetings at the districts to integrate. We sit together with the local government to support the government to integrate so that each sector benefits. We leverage resources. We have got money from the community. Each among of you pays something on Sundays. We support the government to at least leverage resources to integrate so that the community, and we do this on behalf of the government through the Ministry of Education with little funding from the partners like UNICEF. So briefly, that's what you do to integrate. We map. We offer free human capital to the community. No employing somebody, but somebody working for the church. At least you participate in coordination meeting at the sub-county level, at the sub-county equivalent to a parish or a diocese. Then also to the mosque level, we participate in the local government structures so that we can integrate together the services we own. That's what we do.
Thank you, Haji. To your neighbor.
Yes, thank you so much. So how are we doing this? We are using the Boost for the Youngest approach as Save the Children. We have 25 ECD in the centers in the 3 districts. That is Madio Kolo, Terego, and Yumbe. And out of these 25 ECD centers, we have what we call the mother-baby areas. So they are semi-structured buildings constructed within the ECD centers, as well as also other 3 health facilities in the refugee settlement. So what are these mother-baby areas? These are safe spaces where mothers come, where caregivers come to the center and bring in their children, especially those ones are below 3 years, that is 0 to 3. We provide parenting sessions to these mothers, and then these babies below 3 years, this is where the babies engage. The babies interact with each other, so that by the time they are transitioning from the mother-baby area to the ECD, the baby is able to interact with other children. The baby is able to cope up with the baby is able to learn the basic thing. So still with this, the Boost for the Youngest approach, we are implementing it hand in hand with the nurturing care framework, of WHO, which has the 5 domains. Those are really few, and they believe that nurturing of the child is not their responsibility. So as Save the Children, with Ministry of Gender, Labour and Social Development, we developed this Boost for the Youngest approach, and we are using it to cascade. In the male engagement tool, still it has the 5 domains. That is the family vision, father's vision for the family. So what is this father's vision for the family? We discuss with the males in focus group discussion and the caregivers, what are their roles and responsibility within the families, as well as also family health. How do you support your family? How do you support your wife for antenatal? How do you, what are the medications? Sometimes most of these men don't even know that the women, the settlement are getting these children. So most of the men we had in the focus group discussion, they are like, yes, no, these babies are too young, we can't play with them unless when the baby is above 3 years, that is when it makes sense for them. So we are telling them, no, you have to start playing right from even when the wife has conceived. You have to start communicating with this child. When the baby is born, tell stories. They are like, no, this is for the men. They are the ones who tell stories. They are the ones who read books. So this is really an area where we are really emphasizing for the males to also really get engaged in nurturing care. Thank you.
Okay, thank you very much.
All right. Thank you. As a local government, what we do majorly, we disseminate the policy, the National Integrated Early Childhood Policy. We disseminate to the stakeholders. In the process of disseminating, we also go far to the process of sensitizing parents in the villages. In meetings, we have to be there and advocate and lobby for ECD. As a district, we have advocated and lobbied for partners like LABE, that has established a lot of home learning centers in Koboko district, in the village areas where proprietors cannot go and establish an ECD center in the village where you cannot make profits. LABE has helped us. We advocated, we talked with them, and we went to the villages, brought in the parents. We talked with them, and after talking, they established the center. They went to the process of village saving and loan associations in order for them to pay the caregivers. They also continued with, we were very grateful to LABE for that. We also lobbied and advocated for FCA, where FCA has supported us. Operating partners, UNCR, UNICEF, that has helped us in funding in our quarterly coordination meeting, CDs. We now have them. Thank you.
Okay, thank you very much. I think want to applaud you, first of all, for the work that you're doing. Clearly, you're making a contribution to implementation of the policy framework. Of the successes and some of the lessons that we have learned, maybe since we started this implementation or operationalization of the policy in 2016, what would you see as successes, lessons, and possibly next steps that we need to focus on?
Thanks so much. I think some of the things I'd already mentioned. First of all, development of the policy itself is a success. Developed the service delivery standards to simplify this policy so that it is easily understood and adopted, implemented. I think this is one of the working groups which sits very oftenly compared to others. Many of you are partners. We usually invite you to share with us the success stories and other actions you are doing at that level. Further, the other strategies in the use of the whole of government approach, to mention that NIRA in particular is now using these centers to register our children. Policies, guidelines need to be coordinated troop movement in terms of quality control and so on and so forth. So those are some of the lessons. However, we have also learned that we need not to leave no child behind. My brother Mondo said it, universal access for all children below 5 years. Two, we have learned that Since these service centers are already mobilized unit for other services by the partners, the issue of commodity stockhouse needs to be addressed. Next steps. As a ministry, ours is no surrender, no retreat on matters of children. If you want to clap for me, clap properly. We want to do 2 or 3 things, but which has a scale that can increase it from 0 to whatever. We are going to roll out the service delivery framework. Our target is to roll it to all local governments. 2, we are going to develop simple monitoring tools that can easily be used by any partner. We want to increase our collaborations with MDS and other partners in the delivery of ECD services. We think we are doing a lot in coordination, but more needs to be desired.
Thank you. Thank you very much for being understanding. I'll move straight to Haji. Haji, you articulated very clearly the role that I think the faith-based organizations are playing, especially in relation to mobilizing the communities, but also as service delivery, structures to deliver on this policy. So my question is that how can we work with the FBOs to push this agenda forward? How can we harness the structures that you mentioned to make the most, to make sure that there is access to increasing access to quality ECC services for children?
ECDC is 1845, 1847. How do you harness it? It's just a matter of collaboration and coordination. We have a very good structure. All FBOs, again, they've got about 60 leaders, no structures up to the grassroots. So how do you, that is the Catholics, then Namirembe. When you work with them, collaborate with them, because they have all the data you need since 1845. Then you go to the district within your coordination meeting. If you leave